Now, first of all, what do you make of the current global response to this outbreak? Is enough being done, or have governments been perhaps too slow?
Well, it's clear that there is a response, but some of the governments have been slow in responding. And in particular, what is important is, as we know, the epidemic curve is rising like this, and unless you really immediately install measures that cut the curve of the epidemic in the population, like hand hygiene and social distancing, you have no chance not to be hit by the wave. So you have to go in sequence very fast when you raise up with the precaution measures.
Now, in your expert opinion, do we have any clearer idea at the current time about how long this pandemic could last and how far it could spread?
Well, how long, only magicians can tell that. Well, the best school of epidemiology in the world predicted that the peak of the epidemic in China would be at the end of April, and actually China, with drastic measures, could actually curve and turn down the epidemic mid-February. So it means that the measures, when they are very drastically applied, are useful. I don't want to say that the methods that were used, I'm not approving all the methods, but the principles were right. So containment is absolutely key in these. Social distancing and hand hygiene, whether with soap and water hand hygiene, which works perfectly on the virus, or with this alcohol-based hand rub that you talk about, that you use quickly, that actually clean your hands very, very quickly and effectively.
Now, just what is the situation like where you are in Switzerland? Is the model there that's being used there one that other countries should be following?
Well, currently in Switzerland, we are actually at the beginning of the wave of the epidemic. So we were able in some regions of Switzerland to slow down the pace by acting on the field. So it means ahead of the hospital, it's very, very clear that public health is a key parameter. Again, hand hygiene, social distancing, stay at home if you are sick. And now people need to stay at home in Switzerland. Unfortunately, one part of Switzerland in the Ticino region, close to Italy, is suffering more than the rest of the country. But of course, the entire country will be facing this wave that is still rising in our country.
Now, there has been lots of fake information and false news which has been spread about this pandemic. What do you think is the truth that all of us watching and those watching at home should know about?
Well, actually, I think that for us working in hospitals and in public health, we spend a third of our time to face fake news, which is totally disrespectful of those people working. So I would call here for people to stop this fake news, because they are totally unuseful and really a real problem today. So there are many fake news that we need to stop immediately. Let people work in hospitals to do their work, and let people in the government just tell you what to do, and please be respectful of what is told to you to do.
Okay, Didier Pittet, the director of the Infection Control Programme in Geneva, thank you very much for being with us.